are you sleeping? Are you sleeping? I'm Dr. Shelby Harris, licensed clinical psychologist and director of sleep health at Sleepopolis, where we dive deep into all things sleep. If you like Sleep Talking with Dr. Shelby, take a second right now to like this video on YouTube or give us a 5-star rating through Spotify or Apple Podcasts. It seems simple, I know, but it helps us reach a lot more people to get them the rest they deserve. And if you're tired of hitting that snooze button, hit the subscribe button instead. A new episode of Science-Backed Sleep Tips is available every other Wednesday. Too often, sleep is marketed as something you need fancy gadgets and accessories to do well. Something you need an hour-long wake-up and wind-down routine for. But most people don't have time or money to spare for so-called sleep luxuries. In this episode, we're taking a closer look at the social determinants of sleep, the conditions in which people live, learn, work, and age, which affect their health. To help, we've invited novelist and journalist Jessica Grose. An opinion writer at the New York Times, Jessica explores culture, politics, religion, health, and the American family through her twice-weekly newsletter, and is the author of books like Home Economics, How Couples Manage Their Money, Sad Desk Salad, and most recently, Screaming on the Inside, The Unsustainability of American Motherhood. Jessica, thank you so much for being here, and welcome to Sleep Talking with Dr. Shelby. You know I'm a big fan of yours.
Oh, thank you so much for having me. I'm very happy to be here.
And I really do think you have quite a unique and, dare I say, powerful voice in the field. So I love a lot of the work that you've been doing over the years. So I hope that we can dig into some of that stuff throughout our conversation. So obviously, when it comes to sleep and the ability to prioritize sleep, everyone is different. And on my podcast, we've talked in past episodes about sleep needs for older adults, for kids, for pregnant women. Night shift workers, cancer patients, all these different types of patients and people. And today, I think we're going to go a step further and talk about the conditions that really impact our sleep. So, when we think about these conditions, Jessica, all these social determinants for sleep, what factors for you really tend to come to mind? And how do these factors tend to impact people's sleep quality, quantity? Are there things that really come to mind, top of mind for you?
Top of mind for me is definitely fragmented sleep.
Okay.
So I didn't really think about this until I had kids, although I was never a great sleeper myself. But
Ah,
just, the constant wakenings at night.
hmm.
And this happens depending on the family for many, many, many years.
Yeah.
So, I remember when my kids were a little bit older, I think they were like 5 and 8,
Yeah.
there was 1 month where we got woken up every night by
Oh my
one thing or
gosh.
another, and
Yeah.
there was nothing really wrong. They're pretty good sleepers, but it was just like, "Oh my god, are we ever gonna get a solid night of sleep again?" So the fragmentation, not just from, children waking at night,
Yeah.
but also from stress. So I think the effects of stress on sleep
Okay.
are just profound. And obviously, you're the expert and could talk a little bit more about that. But either trouble falling asleep, frequent night wakings, um, you know. I have heard from a lot of people who worked in stressful jobs
Hmm.
that they did not realize how tired they were
Yeah.
until they retired.
Okay.
And once the stress of that work was no longer, um, hanging over them, they were like, "Oh, this is what a good night's sleep feels like." So those are the 2 sort of big ones that come to mind for me.
So how do you think when it comes to like socioeconomic class, right? You're talking about work and income and social status. Do you think how do you think that plays in a lot? And do you see that being an issue maybe on social media when it comes to sleep? Like, do you notice it much?
Yes, for sure. I mean,
Okay.
as you said, you've talked about shift workers in the
Yeah.
past. So, we have a relative who worked the night shift as an EMS, as
Okay.
an emergency medical. And she stopped doing that. She's in her 60s. She stopped doing that 20 years ago and feels
Hmm.
like her sleep is still affected to this day
Wow.
from
Yeah.
working the third shift. Like it just was really tough to be, having your hours flipped from everybody else's schedule and being asleep during, during waking hours. I mean, another sort of economic determinant of sleep is noise.
Hmm.
And so, it's not 100%, but lower income neighborhoods tend to be noisier. The air quality is worse. And so there's sort of environmental factors that may be affecting sleep that maybe aren't going to show up on a survey,
Yeah.
but have sort of a long-term impact on the quality and duration.
Do you know if there's anything being done to help with those sorts of aspects when it comes to maybe environmental aspects that might be impacting sleep?
Not that I know of.
Yeah.
I mean, especially, I mean, noise pollution seems to only be getting worse.
Yeah.
And in terms of, the noise of just cars and trucks and, the volume of traffic, all of that. And, I think you're more likely to live near highways if the lower your income is. And so, like, all of those sort of environmental things, I don't know. I have not read about them getting better, but
Yeah.
I'm not a completist in the field.
Yeah, it's interesting. I put a question up on my Instagram page this morning just saying, does anybody have any questions about like social determinants of sleep? And the noise pollution was a big one that people were asking about. And I just don't know of anything specifically that's being
L
done, and it's a real shame.
Yeah,
Um,
light pollution is another
yeah,
one. I mean, especially for people in urban areas,
yes.
it's very rarely talked about, but just bright lights everywhere all the time.
Yeah, and those were things like when I worked in the Bronx at Montefiore, those were things that I had to think about a lot of times was living environment, right? We have these great recommendations in sleep medicine of, keep everything quiet, dark, cool, comfortable. And we have to think about socioeconomic status as well. Like, is everyone able to get a new mattress, to get these crazy expensive mattress toppers that are going to cool their rooms? There's the noise of the subway that's nearby, the lights, like you said, outside. And I think what frustrates me are the recommendations online that don't take into account this stuff, and a lot of it comes from a place of privilege a lot of times, like, "Oh, we'll
Mhm.
take an hour to get ready in the morning. Make sure you're getting a lot of bright light and walk around." Like, I don't know who has the time to do those things. Do you
Right.
see a lot of that as well with the
Oh,
stuff that
yeah.
you're
I
seeing?
mean, a
Yeah.
lot of the a lot of the recommendations, like, wait an hour to have
Yeah.
coffee. If I waited an hour to have coffee after I woke up, I would not nothing would ever get done in my household. No children would be awake, no one would leave for the day. Like,
Yeah.
it's just like, yes, maybe that's optimal for, my circadian rhythm, but, like, it ain't happening for me.
Believe it or not,
Um
there's actually debate about that being true, to wait an hour. So,
Right.
drink the
I'm sure
coffee.
there yes. I mean, on many of these things, and again, you are the expert. Like, I feel like the science is mixed
Yeah.
on a lot of things, and it is, I think that's when I do health coverage, I
Mhm.
always try to make clear that, like, yes, for the population at large, these things might be absolutely true, but that doesn't mean that on an individual level, they will always be one size fits all.
That's interesting. So you have to take that into account when you're doing a lot of that coverage, I can imagine, especially like
I'm
the parenting and stuff.
Yeah, I really try my hardest. I really try to caveat as much as possible. I try to be honest
Mhm.
when the research is mixed, even if it is mostly in one direction. So, a good
Okay.
example of this is, I just did this big series on ed tech, on,
Yes.
technology in the classroom. And while my overall take was that the way it is being used now, it does more harm than good.
Mhm.
I wanted to be very clear that especially for kids who are learn differently, who have disabilities, tech can be a complete game changer. I mean, they're
Yeah.
all just tools. How we use them is the important part. But I felt like you always need to acknowledge that every, person using a technology is not the same, and the way that they are using it may be really different, and the needs that they have may be wildly different. So, that's just a sort of example when you're sort of looking at a body of research and you're looking at, the whole population, there's almost always at least one thing that you're like,
Hmm.
this is an outlier that I really want to be sure to recognize.
Yeah, and I think that's actually another interesting piece is the ed tech like you were talking about. I absolutely love that series that you were doing because it was looking at well, why don't you tell people about it? Because it's a little bit different from the topic that we're talking about overall, but I think it was a really important column and it can tie into sleep a lot.
Yes. I mean, the screens and sleep is
Yeah.
huge, especially for teenagers. And, a lot of, there are some people who believe, and again, because this is such a big topic, there are
Yeah.
a lot of mixed signals, noise, opinions. But in terms of teen mental health, one aspect that some believe is affecting teen mental health is they are getting less sleep. Like
Hmm.
that is true. That has been tracked that teens have been getting less sleep over time. And some attribute that, lessening of sleep to having screens in the bedroom, having, being on screens later, having, more access to more screens. So again, not 100%. I am not saying like the reason that teen mental health is worse is because of screen. Like, no, I'm not saying that.
Yeah.
I'm saying like it's a very complicated issue, and the data is messy and we're all sort of just trying to figure it out. But the series that I did, we've been hearing a lot about teenagers and screens at
Yeah.
home and just in general and having smartphones. And I felt that there was very little research about how much kids are using screens in the classroom,
Yeah.
how much time they're spending on screens, what are they using it for. So I launched a survey of Times readers, and I got about 1,000 responses from teachers and parents, and a couple from students.
One from me.
And it and, the overall
Yeah.
picture I felt suggested that since 2020 and 2021, when kids absolutely had to have screens to learn,
Hmm.
things have gone a little bit off the rails in terms of overusing screens for tasks in school that screens are not needed for. And in fact, the screens can be detrimental. So the sort of most disturbing thing that I heard that, still bums me out to think about is that in some schools, they are complete digital curriculum K through 12.
Yep.
So kindergartners no longer have physical books. They're
Hmm.
reading on iPads. And there is research that shows that there is a cognitive process that happens when you're reading, paper books that is different from when you were reading on a screen. And I think for those lower grades, especially, it is very important that they are not spending a ton of time on screens. So, again, it's very nuanced. I think there's a lot more use cases for it in the older grades,
Yeah.
but my overall feeling was that screens are being overused and they're being used for the wrong things.
Do you think that it depends upon also the school districts and where they are in the country and funding? Is that at all impacting it?
Oh my god, it's everything. I mean,
Yeah.
a lot of it is, because in the United States, schools have a lot of local control.
Okay.
Um, what the state's laws are, and then what the districts decide to do with those laws and how to interpret those laws and how to
Hmm.
spend the money that is earmarked for technology has a huge, huge effect.
Okay.
And I feel like I hadn't written about this before because my kids' schools, now I come to find out are fairly low tech. Like it didn't seem a problem to me because I was like, they seem to have an appropriate amount of screen use. My
Hmm.
kids seem fine. So it wasn't sort of on my radar until I started really digging into the research and talking to all of these teachers and administrators and parents across the country in all different kinds of districts. So rural, urban, suburban, charter schools, public schools, private
Yeah.
schools, Catholic schools. I talk to everybody.
Do you think that there's reasons why some schools are using tech so much more than other schools?
So, I mean, again, it's hard to generalize just because
Yeah.
every school system is so different, and the populations they are serving is so different, are so different. I would say often not sometimes tech is being used to solve problems that they don't have the money for humans to solve.
Okay.
So, the biggest and most useful use of tech is often in differentiation. So, you're a teacher, you have 30 kids in your class. You cannot meet every student where they are. So the kids at the top of the distribution are going to be bored, and the kids
Hmm.
at the bottom of the distribution are going to need a lot of extra help. And you're
Okay.
only one person. And so I think a lot of experts would say the problem that is being solved by tech, so having, kids work independently using apps or, some other educational programming, um, is solving a problem that would be better solved by smaller class sizes, by having team teaching.
Yeah.
So a lot of, that's a sort of something people are very excited about in the educational space, is having, two teachers, and this is
Hmm.
especially more for elementary school learners, having two teachers, teaching a class, and it causes less burnout among the teachers. So, that was something that I saw often was, it wasn't necessarily it they weren't using tech because they didn't care about the kids. They were
It,
using the tech because there was a serious problem that
yeah.
tech did help, and there wasn't money to have a human solve the problem. But
Okay.
the human-centered solution was perhaps the better solution
But the
and
tech
the more
there.
effective solution.
Okay. But the tech therein is creating bigger problems because it's creating more reliance on technology, more reliance and addiction, shall we say, to it, that when they come home, a lot of times it's a bigger struggle. And sometimes if kids aren't having someone with them all the time, then maybe the tech starts to become used more. And then we see it impact sleep at night,
Right.
movement, all that sort of stuff. So, okay,
Right.
interesting.
And I heard about just a ton of misuse in those
Yeah.
situations. So kids watching YouTube when they should be doing, not
Mm-hmm.
in the perfect world where they were all doing exactly what they were supposed to be doing on those devices and not being distracted by them, it would work. But that's, the
Yeah.
world is not
Creating
perfect.
bigger issues.
Exactly. It's creating some other stuff.
Now, the other big topic that I wanted to talk with you a lot about when we talk about like social determinants was is your book Screaming on the Inside. So the Screaming on the Inside, the Unsustainability of American Motherhood. That book was so powerful when I read it that I would love for you to talk about just that unsustainability of American motherhood, because a lot of the people that I work with are young moms, moms in the thick of it, who are really struggling with their sleep, and the support aspect and social support is really a struggle. So, how do you see our society either changing or not changing that's impacting this, and then therefore impacting mental health and sleep in moms?
Well, I mean, the biggest problem is that there is just simply too much for modern parents to do.
Okay.
And children historically have not been raised in isolation by one person or two people.
Okay.
So, they're and in many cultures, this is still the case where there's more multi-generational living. There's more of a sense that children and support of families is a community-wide project. It isn't just for two parents to solve themselves and to do everything themselves.
Yeah.
And so that, in terms of the holistic experience of being a parent and the physical um, pressure, especially on mothers and birthing mothers.
Hmm.
I think that is the biggest takeaway from my book. Like, there's just not enough support, especially in this country, especially in this culture. So, just starting with things which I'm sure you've talked about before, like there's no paid parental leave.
Yeah.
So, lots of mothers are going back to work within a couple weeks of giving birth.
Hmm.
Um, at most 3 months after giving birth, when their
Yeah.
kids are probably not sleeping through the night. If they have other kids, the kids aren't sleeping through the night, and you have additional children to take care of, but
Hmm.
you don't have any space in your day to rest.
Yeah.
And the cumulative effect on your body from these periods of strain and stress and sleeplessness, like I don't even know how one would measure that. But I assume it's not great.
Yeah.
So, I mean, just things as simple as that. And that, healthcare is tied to our jobs. And
Hmm.
so, something I say in the book and that I think about a lot when I do my reporting is that we've created a system in which parents can neither afford to work nor
Hmm.
afford to stay home. So
Yep.
they can't afford to stay home because they have no money coming in and there's no paid leave. And they can't afford to work because childcare is so expensive.
Mm-hmm.
Regardless of what their preferences might be, when the childcare is more expensive than, when it's half the family budget,
Yeah.
that's not working for people. And so, we've just created a situation that is really stressful and hard for a lot of parents and making, the whole process of having a family and raising a family so much harder than it has to be. Like, that's the other thing I think about all the time. Like, it just
Mm-hmm.
simply doesn't have to be this way. And people, like, often I hear from international readers and their response is like, we feel sorry for you.
Oh,
Like,
I
they're
could
just
see.
like I'm doing something, some reporting on the child pay gap. So this
Okay.
idea that in most countries, when you have a child, a mother's lifetime earnings take a hit.
Okay.
And one of the studies that I'm looking at is of Danish women. And I found out this week that the Danish healthcare system will pay for 3 IVF attempts. So
Wow.
if you get a child on the first try, you don't get more tries, but they will
Okay.
pay for up to 3 attempts.
Oh my gosh.
And I was just floored.
No idea.
Like,
Yeah.
I had never heard that before. Like
No.
like social support that is for families, for the creation of families, for the
Hmm.
thriving of families, that to an American is literally jaw-dropping. My jaw, like, no joke, my mouth hung open. I was like,
That's
"Really?"
unbelievable. So
So,
what other countries then looking at us is the biggest thing that they see the fact that we don't have the paid parental leave, the child, like
it's
what are
a
the biggest
it's
differences?
all of it. It's all
Yeah.
of it. Because what it is all a system that is working together.
Okay.
And when a government is saying, by not funding things that support families, what
Hmm.
they're saying is families don't really matter here.
Okay.
And so it's not just that we don't have a lot of the social supports that other countries have. It's that there is almost a public disdain for families
Hmm.
and a lack of comfort in the built environment and a lack of accessibility to the built environment. So I once did a story about this really adorable show that's on Netflix. It's a Japanese show called Old Enough, and
Okay.
they depict really little kids going on their first errands by themselves.
Hmm.
And when I was reporting the story, one of the things that stuck out to me was there was an article in Slate that talked about the built environment of Japan
Hmm.
and how it is extremely walkable and it is much safer for little kids to walk by themselves, and that there's this culture around little kids that expects them to do things by themselves, to go to the supermarket without a parent. And
Wow.
it's again, it's like a whole, so it's not just one thing. It is an entire cultural acceptance of families as having a place.
Interesting. And I think even thinking about safety, going out, doing that stuff, that even varies drastically in the US as well.
Yes, yes.
And oh my gosh, that's really interesting. So, if you were to think about mothers in the US, what do you think are the biggest things that we would need for support? Do you feel like it's equitable division of, things at home to be done? Like, what do you think are the things that parents are needing the most right now to help prioritize sleep, to help reduce stress, their mental health, all the things that would impact sleep at night?
I mean, honestly, and I say this a lot, I think the biggest thing that would help parents is to have healthcare unyoked from jobs, to have
Fascinating.
universal
Yeah.
health care, because a lot of job decisions made not just by parents or caregivers but by everyone
Hmm.
are to get health care.
Yeah.
And they're stuck working longer hours than they need or want because the alternative is kind of no job, right? Like, it's a
Yep.
good job that has benefits and health care, or it's freelance, or it's, really low paid. Like, there's no sort of flexible, decently paid opportunities. And I
Yeah.
think part of that is because of the original sin of healthcare being tied to a full-time job.
And I
So
can
I
speak
think,
to that. Yeah.
yeah, yeah.
I
Speak
mean,
to it. I want
I
to hear it.
so I worked for many years at a very well-known hospital in New York City, and I absolutely loved my job. Absolutely loved it. But the being a psychologist in a hospital in New York City, it just does not it doesn't pay to a really good, like a sustainable wage.
Right.
And I worked there when I had kids, mostly for the healthcare because my husband he was at a new job and didn't qualify yet for benefits. And
Yep.
I really stayed longer. I was paying for health, or I was paying for childcare even. And it was like, even, it was the childcare was, basically my salary a lot of times. And I was working for the insurance until my husband could actually get insurance so that I could then go into private practice where I wouldn't have my own insurance right off the bat. So
Right.
it's a decision that I had to do, even as a mom in New York City, right? And who's a PhD level person. I think, and it's something that so many people struggle with.
So many people struggle with it, and
Yeah.
it is the scariest thing in the world
Yeah.
to fear losing your health care for your
Yes.
family. Like, it's a horrible, horrible feeling. And so if there were universal health care and we could choose jobs and in different seasons of our lives that
Mm,
better fit our caregiving needs or our health needs or whatever it was,
right.
I just think it would be better for parents, it would be better for society. Because I hear, there's this idea that like stay at home parents and working parents are some like different breed, and it's like, no,
Yeah.
they're usually the same people at different points of their lives. And so the idea that like maybe you want to pull back or need to pull back when your kids are
Okay.
little, but then when they're older, maybe you want that very full-time job because your kids are out of the house. Like, it's just like
Yeah.
our working lives are so long. They're like 40 or 45 years long. Like like the idea that like
Yeah.
the only way to be of use to society is to have a full-time job for 45 straight years. Like, people are living a really long time. We should
Yeah.
rethink that whole thing.
Yeah.
So,
That's exhausting.
yeah, no, I know. Every time I think about it, it's like I'm like, "Oh my god, another 20 years?" So don't think about it. But
Okay.
that's like the number one for me. Um, then I would say paid leave. Just
Okay.
paid leave. Like, I didn't have paid leave for when my first kid was born because I was freelance, and I went
Mm-hmm.
back to work when she was 6 weeks old. With my
Wow.
second kid, I
Yeah.
had 2 months of paid leave, and I
Yeah.
went back to work. And intellectually, I actually was ready, but I was exhausted. I don't have
Yeah.
a physical job. I'm not a nurse
Yeah.
working shifts. Like, my job is very physically untaxing. But, it would have been nice to have 6 months.
Yeah.
Like, I would have
I'm
really
there
liked
with you.
that. Yeah, so, I think paid leave in terms of those early days is really huge, and then the cultural stuff
Yeah.
really, really, really matters, and that may be the hardest to change because
Hmm.
it's just really ingrained in all of us, and, um, I think it's I think a lot of talk is about dads doing more.
Yeah.
100%. All the statistics show that dads don't do enough. They
Yeah.
don't do as much as in heterosexual partnerships. Obviously, not everyone's in a heterosexual partnership, but in a
Mm-hmm.
heterosexual partnership, moms are uniformly doing more.
Yeah.
But things like, I did this story about a mom who was trying to be egalitarian and reach out to dads when she was scheduling a birthday party for her child. And some of them acted like it was inappropriate. Like, who is this strange woman
Yeah.
reaching out to me? And so there's all of these cultural norms that we are all
Mm-hmm.
so you can be 50-50 down the middle or whatever is the like appropriate thing
Yeah.
in your house inside your house. But you have to deal with what's outside your house,
Yeah.
which is very much geared towards the mother being the primary parent.
Right. Like
Um,
who does the school nurse call first?
Right.
Right.
But the school nurses, again, the school nurses will say, yeah, we call the moms because the dads aren't picking up.
Oh,
So it's not
interesting.
like that it annoys them when
Yeah.
they're like, why aren't you calling the dad? It's like, we don't call the dad because he doesn't do the thing we need to be done.
Yeah, and they need something
So,
done immediately. Yeah.
right. So it's something that's totally it's just like this really sticky
Yeah.
cycle, right? And so it's like I want to say both that, like, certainly dads could be doing more, but also acknowledge that, like, there is so much work to be done more broadly. And so I'll also hear about, like, dads who are stay-at-home dads, or maybe they're gay dads, and they're trying to, like, socialize in their kids' social circles, and a lot of
Mm.
times the moms will not include them
Huh.
because they're like, "It's weird, like, it's a girls' night." Like, so there are barriers for dads who want to be involved, social
Yeah.
barriers that I think we also need to talk about. We can't just pretend like, "Oh, dads aren't trying." Like, a lot of dads are really trying very hard, and so I wanted to say that as just, like, sometimes I feel like in this discussion, it's like, "Dads stink," and it's like, yeah, a lot of them do, but, like, a lot of them don't.
Yeah,
It's, uh
my daughter had a field trip yesterday at the Bronx Zoo, and it was all the chaperones that went. My husband went. He was lucky enough that he could take a day off from work, but there were actually a number of dads that went on the field trip who all took off from work, which was really lovely to hear about because I don't think it was that way a number of years ago, for sure.
Right. And so
So
that's awesome. But
yeah,
like there's just like a lot going on. So even if you're tending to your own garden,
yeah.
there's just a lot of additional noise to deal with.
What about for single parents?
I mean, they are just doing it all. They are
Yeah,
exhausted. They're completely exhausted. Again, the systems are really built for two-parent families
yeah.
in ways big and small. And so, they are more tired, they are more stressed. They tend, they really rely on a village more often,
Hmm.
which is great. But yeah, they're exhausted.
Do you see big cultural differences within the states about doing it all, getting everything done? Like, are there certain cultures that you think have more collaborative ways of doing things? Like you said, multi generations in one house. Like, do you notice differences there and people maybe having better outcomes, feeling more rested, having more support?
I wouldn't say like it's geographic. I would
Okay.
say it's having family.
Okay.
That is the superpower. People who live near their family and their family are, well enough and active enough to help them, or living in communities where people are close together and there really is a sense of support.
Mhm.
But those can kind of be found anywhere. Like, they can
Right.
be found urban, suburban, rural. Like, it's very um I wouldn't say it's more likely to be found in any specific place. And I do think, I think religious communities can be incredibly supportive.
Hmm.
And, again, it depends on where, when, in what way. But, often there's sort of, you know, childcare that is church based or temple based. And so the whole sort of
Okay.
community grows out of that.
Oh, that's interesting. So, is there anything you think people misunderstand or don't really appreciate about any social determinants for health in general?
I think we've really touched on so
Okay.
many of them. I think there's Yeah, no, I mean, I don't have any additional things to add that
Nothing
we
extra.
haven't. Yeah, no. No.
Okay. Jessica, we end each and every episode with a segment called Something to Sleep On. So, it's one last point you'd like to share with anyone looking to maybe improve their sleep at night and help make time for sleep, or like we were talking about, improve their sleep quality. Is there, considering everything that we've talked about today, whether it's cultural, socioeconomic, I mean, there's so many factors. Do you have one last thought for our listeners, something maybe for them to sleep on?
Yes. So, what I always tell new parents,
Hmm.
if you feel really emotionally afraid, uh, leave the house for a day. Go
Oh,
sleep someplace else. Go
okay.
sleep at a friend's house if you can afford a hotel. Be away from your family for your children for 24 hours
Hmm.
and just sleep. Because I can't tell you how many times when my kids were little, I truly thought I was losing my mind. I was just very tired.
Yeah.
Like,
Yeah.
I was just so tired, and I would take a long nap or finally have an actually restorative night of sleep. And I would be like, oh, I'm not losing my mind. I was just exhausted. So I
Mm-hmm.
think especially in those, baby days, like the worst for us, honestly, was not, my kids were pretty good sleepers as newborns
Yeah.
or like regular sleepers. When my older daughter was 4 and my younger daughter was 1, and my younger daughter just decided for a couple months that she was just going to wake up
She's
every
done.
day at 4:30.
Yeah.
4:30. She slept through the night. She just
Yep.
was like, 4:30. I'm
Party.
here. I'm up.
Yeah.
I'm here to party. And when I say it destroyed both of us, like
Yeah.
my husband and I were zombies. I don't know how, like, some people can wake up at 4:30 and be fine. I am not one of them.
Yeah.
Like, and so just, we both, I think in that period, like took nights off just
Interesting.
to take, I don't think
Yeah.
we even left the house because our kids were a little older. They weren't like babies, but it was
Mm-hmm.
like, I'm going in the bedroom. I am
Yep.
closing the door.
Yep.
No one is allowed to come in here. I will actually fall apart if I do not sleep. So it's just sort of like taking note of your emotional state when you have really young kids and thinking like, am I actually really upset, or am I just
Tired.
very, very
Sleep
tired?
deprived. Right.
Yes.
And I think also being able to have the ability to have the help to be able to do that is a big
Yes.
thing,
Oh,
right?
it's
So,
huge.
yeah. And
Yes.
talk
So
about
if you're
social
a
determinants, right?
exactly. So if you're a
Yeah.
single parent and you're lucky enough to have a family member who will just like come sit in the house with the baby and let you sleep, or a friend, or you can
Mm-hmm.
swap childcare, which I know again, like that is the kind of advice that I'm just like, oh yeah, that's so easy to find someone
Yep.
to swap childcare with. It's not. It's very hard. But if the alternative is just throwing up your hands and saying there's nothing to do, it's a suggestion.
I love it. I mean, I'll say to my husband sometimes if I'm done mentally and I'm just like at wit's end, I'll say, tag, you're it. So that's kind of our way of just going, one person taking over for the other person. It can make a big difference if you can have that kind of time out for
Yes.
yourself. So thank you. So Jessica, thank you so much for being here. It was great really talking about this topic, a lot of topics that we actually touched upon that are really important. And I really do encourage people to follow her column and her work in the New York Times and her writing. It's just really wonderful and really gets you thinking about where the country is going and where we need to be making some changes. So thank you again for being here.
Thanks so much for having me.
My pleasure. Thanks for listening to Sleep Talkin' with Dr. Shelby, a Sleepopolis original podcast. Remember, if you're tired of hitting that snooze button, make sure to hit that subscribe button right now in YouTube, Apple Podcasts, Spotify, or wherever you are listening. And for even more sleep tips, visit sleepopolis.com, and don't forget my Instagram page at SleepDocShelby. Today's episode was produced by Ready Freddy Media. Our Senior Director of Content is Alana Nunez. Our Head of Content is Molly Stout. And I'm Dr. Shelby Harris. Until next time, sleep well.